Well, hello there. Thank you for your interest in Claris Continuum. Let's take a few minutes to look at why people are saying that Claris Continuum is the most innovative remote patient monitoring system available. Claris is about three things, very simple: engaging patients, improving compliance, and changing behavior. The way that we do this is through a very simple yet holistic solution that allows you to collect real-time data from various medical devices, which we'll take a look at, to provide vitals. In addition to that, we can survey your patients, we can provide medication reminders. There's a library of patient education. You can include your own education, uh, and that gets supplied to your patients based on patient condition and diagnosis. There are three ways to engage with the patient on our platform, all HIPAA compliant through video, through audio, or through chat messaging. One of the unique things about our platform is our family caregiver engagement. So, because of the origin of Claris, we've spent years honing our system to make it very easy for families and caregivers to engage with their loved ones. And ultimately, all that information gets aggregated back into our clinical dashboard for risk stratification to make it very easy for your staff to determine how to optimize their time. So we're going to take a look at this in a little bit more detail. Claris is deployable in a couple of different ways. What you're seeing here is the Claris Continuum tablet. There are 5 different categories of Bluetooth devices that we can connect: blood pressure cuff, weight scale, pulse ox, glucometer, and thermometer. In addition to that, we have another way of deploying it without a tablet, requires no device, in fact, and we do this through cellular connected devices. And here are 3 examples of those devices that we offer. There's a cellular connected blood pressure cuff, weight scale, and we even have a cellular connected glucometer. Let's take a moment and let's go look and see how a patient uses the system. So this is Edith. She's a CHF patient. You can see her tablet sitting there on her table. As long as the patient can take their measurement or there's a caregiver that can assist them, they're a good candidate for the system. Anytime you take a measurement, we're going to display that to the tablet. We do believe in self-care, and this is part of, I think, driving and changing behavior. When seniors and chronic care patients are able to see how they're doing and see their progress, this becomes more engaging for them. And there's nothing that the patient has to do with the tablet because the tablet is always listening to these medical devices for a Bluetooth transmission of data. So here you see the patients taking their pulse ox. Once they're completed with that, you'll see the data will display on the patient's tablet. And with any vital, we're always going to show this trend line. Now I'm going to pause it here and let's take a look at the trend line. So everything's going pretty good, but we see on February the 10th, we had a significant drop in oxygen saturation, certainly below this acceptable threshold. So what happens in our system is this data is feeding the care console real time. So let's go look at the care console. And this is what your staff is going to actually see. So this represents your RPM population. These are all the members of your program. And Continuum will risk stratify those patients that are having outliers based on vitals. It could be outliers that tie into reimbursement, or it could be a number of other alerts. So you can see how these patients are moved up to the top. So for example, if you look at Ms. Sanders here, the blood pressure is out of compliance, and that has created an alert. Let's go down and let's look at an actual patient record. So this is Ann Levy, and you can see that we've got a couple of cautions here. This yellow or amber color is representative of something that's not necessarily urgent, but it is trending outside of the norm. You can also see the number of measurements she's taken, 5 days of readings in the last 8 days. So that's really important for reimbursement. We're also keeping track of the total amount of time that your monitoring staff is working with each of these patients. So let's open up Miss Levy's chart here. So we're always going to show you how things are trending based on what in the care plan we're tracking for that patient. And one of the things that our customers really like about the platform is the ability to set up what we call care programs or care plans. And basically, this is going to guide the patient through the items or through the activities or through the collection of data that's important for their clinician. So you can see here, for example, you've got a morning care plan that consists of 3 vitals, a wellness survey. There's an exercise program on stretching. There is another survey question on chest pain. We're going to scale that pain, and then we're going to finish that plan of care with a reminder to take their medication. So let's actually go look at what Ann Levy sees on her tablet. One of the nice things about the platform is you can actually view the patient's tablet. So, and you hear the tablet just gave a little chime because it is reminding the patient it's time to take your blood pressure. Now, for time's sake, I'm not going to take my blood pressure, but I'll skip this and you'll see that it's going to go to the next activity, which is to take weight. Again, we'll skip that. The third vital that we wanted the patient to take is pulse ox. We'll skip that. And then the system's going to say, well, how are you feeling? So one of the neat things about collecting real-time data is if we go back to the care console, you can see that the last alert that came through 2 days ago was the patient skipped their medication. So let's pay attention to this alert right here on the right in red. And now I'm going to go back, and Ann Levy's going to say, I'm feeling terrible. So as soon as we click that, you can see how fast data is going to update the care console. In fact, if you were the clinician and you were set up to receive alerts for this caregiver, you would also have the option of receiving them on your phone as well. Let's go back to Ann Levy's plan of care. The next option is it's saying, do you want to perform your exercises? Well, for this example, let's just show what that would look like. There's a whole library of different videos that you can incorporate into the platform.
Reach the arms slowly up. Inhale. Turn the palms open and exhale.
And this is one example of an exercise video.
Reach your arms up.
So we're going to pause this and we'll skip to the next item on the patient's plan of care. And now we're going to ask a question. Are you experiencing any chest pain? Again, let's watch how fast data updates the console from the tablet. So patient says, yes, I'm experiencing chest pain, and it immediately updates. And now we want to know, what is the level of that pain? Well, let's just say that pain is very severe. And again, real time updating the care console so your staff knows immediately who they need to be focusing their time on. The last thing I'm going to do is say I took my medication. So at rest, this is a screen of what the tablet looks like. And you can create activities based on the patient's plan of care. We just went through and completed our morning care plan. If this were not a demo patient, this would actually go dim. We have added a COVID-19 symptom check. And in fact, in this for this patient, we have an evening care plan. And then there's some other features and functionality. You might remember we talked about being able to engage family members. And that's a really neat aspect of the platform. You can see that we're able to upload family photos. We can upload videos. So if grandma wasn't able to go watch her daughter play soccer, a family member could easily upload the video. And it's just a nice way to stay engaged. And certainly with the issue of social isolation in the context of COVID-19, this is really important. Two more things I want to show you here on the tablet before we get back to the Care Console. We have a resources button, and these are very easily set up on the Care Console where we can do things like show the patient the proper way of washing their hands. We can include information about coronavirus as an example. And what you're going to see is that all of these items here are just different links to various websites, or it could be something like a video. So here's an example of a video that we included from the Deputy Director, Dr. Butler, here at the CDC in Atlanta.
I'd like to talk to you about the new virus that causes the disease COVID-19.
So anything we want to do for education and keeping patients informed with information about their disease or their condition. Very easy to add those. We can also make video calls through the platform. So let's go back over to the Care Console. You can just press the video icon. And now you see that I'm getting an incoming call here. So we'll go back over. And on my tablet, it says, hey, you've got an incoming call. We'll answer that. And it's very easy to set up a video call. How you doing? All right. You guys don't want to see me on camera. Okay, the last thing I want to point out is for those healthcare providers that are able to bill for remote patient monitoring, which includes physician practices, in many instances, Medicare Advantage programs, some commercial insurance, and we can talk in more detail in a subsequent meeting whether your organization is eligible for reimbursement. I do want to show you that if I try to leave this patient record and go to another member on that console, the system says, well, wait a minute, you've been working with this patient for 8 minutes. We got to document this. So we can document if it's information on the care plan, I can include that. We'll just go ahead and post out those notes. And now we've updated not only the clinical notes, but we're keeping track of the time spent. So now we're up to 26 minutes for billing time. And that is now going to trigger one of our billing codes for monitoring. Okay, well, this is going to be a short little intro video. I hope this is something that is exciting to you, and we certainly would love to set up a one-on-one meeting and talk to you more about Claris Continuum. Thank you so much, and have a great day.